So the topic that I'm going to present to you today is why do people are not socially distancing? So I picked some of these images happened in the first few months during the COVID-19. As you can see, even though government, they post notification, hey guys, don't do a big crowd, but these images showing that a lot of people are actually ignoring those government advice. And COVID-19, I know, has been difficult, and one of the effective way to reduce COVID-19 is through social distancing. And government has been trying to use this approach to make sure that there is less and less infection. Studies actually shows social distancing measure, if social distancing measure being practiced, it is 35 times greater to reduce the infection. As you're probably aware, now in the US, we have one of the highest infection rate, about more than 11 million people get infected and more than 200,000 people died. So despite all this effort, you can see that there are sizable segments within the US society and citizens who perceive social distancing message as something that is inconvenient, irrational, and the purpose of this study is to look at why do people are not social distancing? Can we segment this group? So therefore, when social marketers, health practitioner, the government, they want to get a campaign, they can see these segments. So the study, this study took account the underlying attitude. We are looking at respondent demographic profile, including gender, age, income, and political affiliation, and how those demographic profile affects their attitude towards social distancing. And again, study found that social distancing, this is one of the most effective tools to fight epidemic. So the underlying theory that I'm using for this study is the health belief model. The health belief model is the perception that an individual is vulnerable to disease and that the disease is severe. So how you react to COVID-19 depend on how you perceive the severity of the disease. If you think that COVID-19 is not very severe, if you think that COVID-19 is not real, then you're probably not going to adopt social distancing. You're probably not going to use masks. So the underlying concept that I'm using is looking at the health belief model, and which link to perceived severity. And again, to my surprise, that when we are here, if you are here in the US or maybe around the world, people perceive COVID-19 very differently. Some perceive as a serious disease, some perceive as a hoax, and that affect how they respond to all those initiatives by the government. And also another concept that I'm trying to test is subjective norm. This is also influence a lot of people health-related belief. If people around you think that COVID-19 is not real, then you probably act the same way. So these three concepts is the underlying theory that I'm using to segment this group. So why do segment? Why do we have to segment? Segmentation has been used for decades by marketers. Market segmentation allows people to distinguish homogeneous subgroup within a heterogeneous market. So the purpose of segmentation is to identify a homogeneous market within a heterogeneous market, and thereby it helps you to design and understand a target audience. So the segmentation process, this is important because marketing communication effort, they are more likely to fail when the advertiser, when the government, when the social marketer assume that everybody is the same, assume that they're targeting a homogeneous audience. And that's why the government agency here, the CDC in the US, it's struggling because they don't know the segment within the US population. So we're doing a segmentation. We are collecting data from an online panel from Amazon. We managed to collect about 759 people These are in front of you. You can see the demographic profile of the sample. We have about 59% male and female. We're also collecting data on their age group. Most are within 25 to 34 years old, and followed by 35 to 44, followed by 55 to 64. And also we collect data on their education profile. Most of them have 4-year college and university degree. Their income level varies. Most of them had about 37% had an income of 20,000 to 50,000. And also, because this is in the US, we are collecting data on political affiliation. We had 27% Republican and 47% Democrat, and then 26% independent. So we are using a priori method. So we found, based on the cluster analysis, we found 3 key segments. Okay, 73% segment 1, and then 22% segment 2, and then 5% segment 3. Let's explain the segment that we found. So segment 1, this is the majority of the social distancing follower. And these people they reported that they're following the rule of social distancing. And also this is consistent with other study showing that 75% of the US population felt that most of the population followed the CDC guideline. Segment 2, we call this the in-betweener, 22% of the sample. These people are kind of not sure, is COVID-19 real or not? This is the second largest segment, consisted of what we call social distancing in-betweener. This is in between. And also we found a small majority of the people in our sample, 5% of the sample. This is a small sample. We call this the social distancing rebels. The member of the segment, they perceive social distancing negatively. They perceive this as unimportant. They perceive this as unnecessary. They perceive this as ineffective and also unreasonable. So this is represent that why do people are not socially distancing? So we argue that not everybody, there are a small group of respondents that actually they rebel. So you can see around the world, they're protesting against government lockdown policy. They're protesting with the government mandate of wearing masks. So who are these people? And again, the context of this study is the US population. Let's look closely the characteristic of each of this segment. So in front of you, as you can see, these are perception differences between segment. On your left, you can see segment 1. This is the largest segment. Segment 2, these are the in-between. And segment 3, this is the smallest segment. As you can see that for the last segment, this is the people that rebel. They don't want to be locked down. They don't want to wear masks. You can see the self-relevant mean value is very low, meaning that they think that COVID-19 is not relevant to them. As you can see also on your right on segment 3, the perception of severity is very low compared to, take a look on segment 1. The perception of severity is very high, close to 5, meaning that these segments perceive COVID-19 as real, as severe. But in contrast, the last segment, the rebel, they perceive that COVID-19 maybe is a hoax, it's not real. And you can also look at the subjective norm. They also see people around them don't see COVID-19 as very severe as well. So you can see a contrast that a group of people perceive COVID-19 as very real. They have a good knowledge of COVID-19. And on the other side, the rebel group, the last segment, perceive that COVID-19 is probably not very severe, it's not relevant to them, and they also have the lowest knowledge on COVID-19. And also, another indication in front of you now, you can see perception differences between segments on the impact of COVID-19 construct. As you can see that on your left, segment 1, they perceive infection rate is very high. They also perceive the morbidity rate very high, the mortality rate very high. But on the other side, on segment 3, as you can see that the infection rate is very low. And this is very surprisingly that the same group of population within the US could see COVID-19 very differently. And also you can see the morbidity rate is very low, and the mortality rate for segment 3 is 1.84, meaning that they are denying that it actually COVID-19 can kill people. So this is an evidence to show that in terms of creating a campaign related to COVID-19, either for wearing masks, social distancing, and lockdown, government, social marketers needs to be aware that segment exists. So then when you create a campaign, you need to be aware of all this segment. And the next question that I'm asking, what are the characteristics, the demographic profile of all these segments? Why there are differences between this segment? And this leads to a lot more interesting. Who are these people? Who are the rebel? And who are the segment that follows the government advice? So as you can see, the result is not very surprising, but I just wanted to talk because of time. Segment 1, the majority they kind of equal between gender. But what I want to highlight, and again, this is what the reason, the negative consequences why politics gets in the way in terms of the COVID-19 effort. When you look at the in front of you, the political affiliation almost at the bottom, you can see that segment 1, the majority of the social distancing follower, most of them, they have 22% Republican, and then 53% Democrat, and then 24% independent. While in contrast, if you look at segment 3, 53% are Republican, and then only 5% are Democrat. So you can see this is the impact of politicization of COVID-19, because some of the government, some of the Republican, and the message that they share to the public that it's going to go away, the COVID-19, just keep going, don't worry about it, don't let it dominate you. So there is inconsistency of message, and that reflected now in the data. So probably this is different compared to Australia, New Zealand, where people have the government and the CDC, they have the same message. So the audience get the same message. But when it becomes politicized, like in the US, you can see a negative impact. People perceive COVID-19 differently. So what is the implication? Okay, so what is the implication in the last 3 minutes that I have? What is the implication? So the government needs to have the same message by encouraging, by telling them that COVID-19 is severe, because when the government telling the population, the people that, hey, it's not, it's going to go away in summer, it's going to go away, it's just like a flu, then when the population perceive less severe, of course they will not follow the social distancing rule, the masking rule. And also it shows that the importance of testing. Testing is important because that would increase the awareness of the severity of COVID-19. When people are being tested, they know that they're positive, then they're more likely to do something. So also we found in the study that women are more likely to follow social distancing guidelines than men. So therefore, maybe we can encourage using the theory of subjective norm by encouraging women to encourage people around them, maybe their husband, their partner, their children, to follow the social distancing rules. And also one very important last conclusion and implication, that public health, especially in the US, needs to be bipartisan. You cannot have inconsistent message, government telling you this, and then the health official telling you something different. It's not going to work. So as you can see that now with the pandemic in the US is going from bad to worse, because of the inconsistency message. So that's the conclusion of this study, showing that within the US population, there are segments. So therefore, moving forward, really the government and the health official, that the public health officer need to work together to send consistent message to show that this is COVID-19 is real, COVID-19 is severe, so that when everybody gets the same message, this segment can understand and act better. So I think I had only a few seconds. I just wanted to say thank you for the opportunity. And again, my apology for the technical issue, and hopefully you can learn something from this presentation. Thank you for listening. If you have a question, this is some quick limitation. If you have any question, feel free to email me, and then we can discuss further. Thank you for listening.